Hello, and welcome to another insightful episode of the SYNLAB podcast. My name is Uchenna Amadi, and I'll be your host. Today, we are addressing a question many Nigerians have asked, sometimes jokingly, sometimes very seriously. Does everybody have malaria? I will not be doing this alone today. I have with me here in the studio two incredible doctors who will be helping me to trash this question. With me here is Dr. Olaniyi Owoeye. Good to have you here today, sir.
Thank you.
And I'll be reading his bio immediately. Dr. Owoeye is a graduate of the University of Ilorin and a fellow of the West African College of Physicians. He is a consultant hematologist with over 5 years of post-fellowship experience and currently practices with SYNLAB Nigeria. Dr. Owoeye is deeply passionate about medical diagnostics, the management of hematological disorders, and the translation of scientific knowledge into better health outcomes. He is also strongly committed to the prevention of sickle cell anemia and serves as the Public Relations Officer of the Association for the Prevention of Sickle Cell Anemia of Nigeria, APOSCAN, based in Ilorin. Beyond the laboratory and clinic, Dr. Owoeye is an advocate for sickle cell awareness through creative expression and has contributed poetry to awareness initiatives, including platforms curated by renowned Nigerian poet Funke Awodiya. He firmly believes that health education is one of the most powerful tools for disease prevention and positive health behavior change, and he envisions a healthier Nigeria and indeed a healthier Africa. Dr. Owoeye, it's always a pleasure to have you on the SYNLAB podcast.
Yeah,
always a pleasure. And very interesting bio, I must say.
Interesting indeed.
Yeah. We also have Dr. Modupe Ajibawo. Nice to have you here as well.
Thank you very much.
Dr. Modupe is a seasoned primary care physician with over 2 decades of clinical experience delivering comprehensive, patient-centered care to individuals and families across the lifespan. She has strong expertise in geriatric medicine and is deeply passionate about preventive healthcare, health promotion, and the long-term management of chronic diseases. Her practice is guided by a holistic philosophy that prioritizes early intervention, continuity of care, and empowering patients to make informed decisions about their health. Dr. Ajibawo currently serves as the head of department and consultant family medicine at the Federal Medical Center, Ebutemeta, Lagos, where she provides clinical leadership, mentors healthcare professionals, and contributes to the advancement of high-quality primary healthcare services. Dr. Ajibawo, thank you for joining us. We are delighted to have your expertise on this important conversation.
Thank you for having me.
Thank you. So my listeners, do not forget to like, subscribe, share, and follow SYNLAB Nigeria on YouTube and Spotify. Like we said earlier, we're asking the question, does everybody have malaria? Because in many homes, offices, and even healthcare settings, the diagnosis seems automatic. Somebody has fever, they say it's malaria. Somebody has headache, they say it's malaria. Body pains, let's not even go there. It's definitely malaria. So today we're going to debunk this myth. Do we all really have malaria? This episode is actually part of our series on the effective malaria diagnosis. We will explore accurate testing matters, not just for correct treatment, but for long-term health outcomes. Like I said, do not forget to like, subscribe, share, and follow SYNLAB Nigeria on YouTube and Spotify. I will be starting with Dr. Owoeye. And I want to ask the big question. Why does everybody assume that any small fever or headache is malaria?
Well, I think it's just all about the culture, for want of a better word to use. Most people out there, and of course, I think also honestly, it's because malaria has no specific symptoms that defines it. And of course, usually most of the common symptoms that someone who has a malaria infection will present with is the fever. And so, and I think over the years, most people have just come to attribute any fever, to malaria, because as I said, earlier on, that malaria does not have any specific symptom attributed to it. So there are non-specific symptoms, headaches, fever, body pain, abdominal pain. The list is a long list. So, but there are no specific symptoms like other illnesses where that this particular symptom actually characterizes this particular disease condition. And so, because as I said, fever is almost always present. So, and I think over the years, it has just become, like what everybody does. Everybody attributes it to it. And the fact that malaria is very common here, I would say endemic. So, and of course, we know that one of the commonest causes of fever, in a place where malaria is this endemic, like in, Nigeria and in sub-Saharan Africa, is malaria. So I guess over time, it has actually become something that a lot of people, have, had attributed to, malaria. And however, and I think I would always say this, there are 1,000,001 causes. I mean, well, that's a little bit of a figure of speech.
Okay.
For if fever does not necessarily mean that you have malaria. There's 1,000,001 causes for it. But of course, the usual things, most of the common things, what usually would cause fever commonly, an environment like ours, is just so. I guess as I said, not just to repeat myself. I guess for me, that's why you have.
Let me hear from Dr. Ajibawo. What's your own opinion? Why do people just think that every episode of the general body weakness or fever or headache is malaria?
Yes, like Dr. Owoeye said, is the commonality of malaria in our environment. And over the years, we've known that malaria was common, and there's been health campaigns to tell people about malaria, to treat malaria, to prevent malaria, driven by, health promotion, even by large agencies like WHO and United Nations.
Okay.
So that has driven awareness about malaria largely. And those campaigns were actually important because then they will say malaria kills, right?
Yes,
And
yes.
so because malaria kills really, so it drove awareness about malaria. And so we started hearing, health education, like when you have fever, just take malaria medicine.
Wow.
So since then, people tend to attribute every form of fever to malaria. Okay. And then once they have fever, it seems like malaria. Once they have headache, body pains, it seems it's malaria. And they expect even the doctor to always see it as malaria. So people have tended to equate fever to malaria. Even in our language, I'm Yoruba.
Okay.
Fever is actually Iba. And so they have attributed Iba to malaria.
Yes.
Oh, okay.
So in my own practice, when people come with fever and you start to test for other things and you refuse or decline or withhold malaria treatment until maybe you say they're not happy. They feel you are missing the buckle or the bulk, or you are doing something wrong.
Yeah.
So I think that's one of the reasons why. And then the last thing I may attribute to why everybody thinks a fever has to be malaria is that around here, the ability to test for other causes of fever is actually limited, mostly limited in most facilities is limited. So, but malaria testing should be easily accessible,
like basic,
and it's basic, and so the test and somehow we'll come to that, I'm sure later. You find malaria for those that test, right? And then they say it's malaria.
So what are other common illnesses that we can actually mistake for malaria? Maybe those that present with similar symptoms.
Yes. Like Dr. Owoeye said, malaria symptoms are fever, headache, body pains,
seems
loss
like
of appetite,
of
nausea,
most other.
Those are constitutional symptom or common symptoms, non-defined, non-specific symptoms that come up with every other problem that has fever attributed to it. And, you know, in our environment, you find that common colds, we call them common colds, like catarrh, sneezing, you know, from common viral infections are actually really common, especially in seasons like this. And so they are the most common cause of fever and headache, actually, I think, in my own understanding. So other things in children, you can have ear infections, throat infections, you can have tonsillitis, and even severe problems like brain infections,
and we can mistake it for malaria.
infections, pneumonias, because it's coming with fever, tiredness, difficulty in breathing. Even gastroenteritis, because of the fever, nausea, and vomiting, can be seen as just a fever, and the next thing you want to treat is malaria. Wow. So there are a lot of things that can, even COVID, there was COVID some years ago, right?
Yes.
And there are still some brothers and sisters of COVID around. They come with the same things. They come with this.
That's interesting.
Wow.
Yeah.
Wow. Okay, so let's talk about repeated presumptive treatments. Like when you always think it is malaria, how does it affect the children's health over time? Because you mentioned some illnesses that are actually same symptoms, but you mentioned like tonsillitis that you can see in children, brain, what did you call it? Brain diseases.
Infection.
Brain infection,
meningitis.
Yes, exactly. So how does it affect a child's health when you keep treating the wrong thing over time? When they may be having things like what you've listed, but you keep assuming is malaria, you keep treating malaria. How does it affect even adults as well in the long run?
Yeah. So when you just assume every fever is malaria and you go ahead to treat malaria, you may be delaying the diagnosis of more severe infections and probably, you know, dragging on until those problems become complicated. Of course, we know that things like common colds, they clear by themselves within 3 days to 2 weeks, you know, and so you get lucky with those that even though it's not malaria, it's a common cold. You've given malaria treatment, the common cold will go by itself after some days. But something like pneumonia, by the time you are getting to know, oh, it's not malaria, the child is in serious distress.
Wow.
Or a meningitis, by the time you are actually, you know, treating the fever with malaria, anti-malarials for 3 days, after the 3rd or 5th day, the child is still not getting better. By the time you are getting to the hospital, it's complicated.
Wow.
You've delayed the diagnosis of a more significant, or yes, malaria is significant actually, but you've delayed the diagnosis, and that can lead to complication, prolonged hospital stay, you know, being away from school, you know, infecting others, and all that. So I think that's a major problem. Also, there's a problem of data.
Okay.
We don't go to hospital, we are not testing, so we assume everything is malaria. We don't have the accurate data of whether we are actually having malaria infection, because when you go to the hospital and they test, the medical record quotes that, oh yes, there's been malaria infection here today, or there's been 10 malaria infection, or there's been only 1 malaria infection this week, there's been 10 otitis media, there's been. So when we are not going to the hospital, we're not doing testing, we are not getting the right data.
We are making it difficult for researchers when it comes to the malaria. I see that. Wait, do you have anything to add, Dr. Owoeye?
No, not really. I think she's actually dealt extensively on the subject.
Okay.
Yeah.
So I was going to come to you because I want to talk about the role a proper laboratory diagnosis can play before treatment. So I think we would like to use this medium to encourage people not to assume and maybe do more tests before they conclude that it is malaria. So what role should proper laboratory diagnosis play before treatment, especially in children?
Yeah, well, you really cannot make an assumptive, diagnosis. You need to make an objective diagnosis.
Sorry to cut in. I think that's a cultural issue,
Yeah.
like you said, because a lot of people, like you need to see these people by default.
default.
By
I was going to
default.
say, that was exactly
Like my
what I was
head
going to
is
say.
paining me. They just go and buy Coartem.
Yeah.
As in, but you understand what I mean. So it's really going to. I think we need like a paradigm shift.
Exactly.
I think that's what we need. But please,
Yeah.
need me not to
She
cut
actually
you.
said a whole lot of things, which I think they're very, very important. I need
Yeah.
to underline a few things there.
Okay.
Because we have attributed every case of fever to malaria, then we tend to overtreat malaria. And I was going to talk about, later I'll talk about the proper diagnosis of malaria,
Sure.
but then overtreating malaria also makes you, neglect the more sinister, very important diseases that, might even lead to death of the person, suffering the fever. Then aside from that, there's issue of resistance, that can actually develop to the medications.
Wow.
And because, access to malaria medications, is almost as free as, pure water, or should I say air. You can almost always go to any pharmacy and then get any malaria drugs. Even people who don't even have any medical training can prescribe malaria drugs for you. You understand? So, I mean, these are some of the things that are, the dangers of, just assuming that every case of fever is malaria. And of course, any properly trained doctor knows that he or she must actually test, for malaria before malaria is treated. Now, proper laboratory diagnosis. Well, I don't know if this is a time for me to talk about, certain things about laboratory diagnosis. The gold standard for malaria diagnosis is microscopy. I mean, your ability to see, the malaria parasites and to be able to define or determine the particular species, because malaria has a lot of species, but in our environment, Plasmodium falciparum is the commonest in 85% of cases. And most of the severe, cases that you get in malaria comes from falciparum infection. So your ability to be able to see and then to be able to identify the malaria and the stage, of the infection is very, very important. Now, it's not just microscopy, because there are a few limitations there, because we know that in the primary healthcare settings, you may not really have, proficient microscopists. You may not even have, microscopy.
Yeah.
You understand? So, and that's why the concept of the rapid diagnostic testing actually comes in. The rapid diagnostic testing that is almost readily. She said something earlier on about, the availability, affordability, and the rapid diagnostic testing actually provides this. It's affordable, it's widely available. You can go to any village. I served in Enugu, I served in a village, and of course, we still have. I can remember as far back as at that time, I remembered we had, the rapid diagnostic test kits that would use for treatment. So, there's a standard algorithm for testing for malaria. Of course, microscopy is a gold standard, but then along microscopy, the RDT, then you have in facilities that you can do that, you can do your PCR testing, quantitative Buffy codes. And more recently, we actually have automated machines that are actually comparable to microscopy. I think we have one at SYNLAB, the 6MEX XN31 for malaria, that can also identify and, determine the percentage of parasitemia. You understand? And all that. So we have all these algorithms now. We have, all this. So malaria testing nowadays is more robust than it used to be those days. So you have a whole menu, like a retinue of tests that you can do, starting from your RDT down to your RDT microscopy, down to your automation, and even your PCR testing.
Wow.
So, yeah.
This is actually an interesting episode. I got carried away. I like the way you graded it from the RDT to the gold standard to the automation. Yeah. Is there anything you want to add, Dr. Ajibawo, in the testing?
Yes, just to confirm that, malaria testing is important. Like, it's for the same reasons. Like I told you earlier, that some of these questions, overlap. You're testing for malaria so that you know you truly have malaria. And it's available. And even the RDT are very effective. Like, they are highly comparable to the microscopy in terms of being able to pick up malaria, because sometimes the microscopy depends on the person, the skills of the person looking into the microscope. So, but for RDT, you can actually, so malaria testing is available. And all the people that, even pharmacies, it can be done in pharmacies, because people go to these pharmacies, chemists, and say, I need malaria medicine. I think these people, our colleagues there, can ask, have you done testing? You know, so that it can be done, and then you are certain that you are, because it's difficult for some of us to actually take medicines for 3 days. And in some places, they are prescribing...
Are you talking about the doctors? Because I know that they make the worst patient.
No, I'm a good patient.
I'm not a good patient.
I know you cannot be.
So it's difficult for some people to complete this medicine. So why don't you just test and be sure that's what you have?
Before
Because
you
some of
start.
the things you actually have, you don't need any medicine. Just need to take a break, rest. Some people get
Exactly.
fever from stress.
Yes.
So malaria diagnosis is very important, and it's available.
Wow. Thank you so much for this insightful conversation. Guys, one thing is becoming very clear. Not every fever is malaria, and blind treatment comes with consequences. Please do not forget to like, subscribe, share, and follow SYNLAB Nigeria on YouTube and Spotify. Don't go away. We'll be right back.